Texas Children's Hospital Urology has been in existence for 50 years, and in that time span, there's been 3 chiefs of the Division of Urology, and so to carry on that legacy is a real honor for me. Along with the mission of Texas Children's Urology, we really want to take care of all aspects of a child's care, and that is we want to take care of the most common urological issues, but also the most complex and esoteric problems that simply other hospitals can't really care for as we have. And when I also say what great things we're doing, I really want to say that it's on a scale that's like no other hospital. We are the largest children's hospital in the U.S. and in the world, and we simply have about 12 to 15 million population that we care for.
Texas Children is known for taking care of children with complex medical problems. We are the leading referral centers in Texas and all the Southwest United States. We even accept patients from across the nation as well as across international borders.
We have 4 freestanding children's hospitals with Texas Children's, and we have at those in the Houston area as well as in our new hospital site in North Austin. In addition, we have 13 specialty clinics, and to have that kind of scale of healthcare delivery requires an absolutely committed and dedicated team, which we are definitely committed to.
The Voiding Improvement Program Clinic is a clinic dedicated to patients and children that have urinary incontinence. So this can be voiding dysfunction, giggle incontinence, overactive bladder, enuresis or bedwetting, and frequent UTIs. We have the ability to have in-clinic, non-invasive urodynamic testing, imaging, lots of things that can help us diagnose and treat these patients and help get them dry. Our Voiding Improvement Program Clinic is unique in the staff that we have. I think that's our biggest strength. We have dedicated APPs, PAs, and nurse practitioners, nurses, and MAs that all come together to help these patients. We also work closely with our pelvic floor physical therapists to help get these patients in their clinics and treated appropriately. I think our most unique factor is how we all work together and really care about these patients and improving their lives.
Thanks to our Pavilion for Women and their cutting-edge field care center, we're able to have accurate prenatal diagnosis of most congenital malformations, and that allows us to map out the plan for taking care of children that are yet to be born and also guiding their families through these difficult times. At Texas Children, we provide comprehensive and cooperative care for these children, working alongside with colorectal surgeons, gynecologists, orthopedic surgeon, plastic surgeon, and other specialists such as nephrologists and endocrinologists as needed. Our plans are tailored to each individual children and their families with the goal of allowing for good long-term health outcomes as well as the best possible quality of life, but still keeping in mind that we have to achieve realistic goals.
The Colorectal Pelvic Health Program in Texas Children's, it's comprised of a multidisciplinary group of experts who care for children with conditions such as congenital or acquired malformations of the genitourinary tract or the rectum. Conditions that we treat include cloacal malformations, imperforate anus, bladder, and cloacal exstrophies. Our team is comprised of highly skilled experts in the areas of pediatric urology, pediatric surgery, and pediatric gynecology. Our team also includes social workers and other staff members who help provide care to these very unique patients.
My focuses here clinically are from general to the complex reconstructive pediatric urology, also focusing in minimally invasive pediatric surgery. With regards to research, I focus predominantly on the care of patients with neurogenic bladder as associated to spinal dysraphism as well as spinal cord injury. I also focus on patients with exstrophy and epispadias and pediatric nephrolithiasis. The National Spina Bifida Registry was created in 2008 in order to better understand the natural history of spina bifida and to provide better care to these patients. Texas Children's boasts the largest enrollment in the Spina Bifida Registry, and as such, we are looking forward to providing the best care possible for these patients.
At Texas Children, we strive to provide excellent cares for the families and their children the moment they step foot through our doors. And we're only able to do so because every team member is so engaged and involved from the beginning, and everybody gives their 110%.
When we treat a child, we're not just treating the child, we're also treating the family. And there is nothing more honorable and more responsibility that it's bestowed upon a physician than caring for someone's child. And when you're caring for that child, you're, at the end of the day, caring for the entire family. They have all invested in their family, and that's what you're bringing to the table.